Hey guys, happy Tuesday. Time for Tip Tuesday. So this week I want to talk a little bit about your existing coverage. Now that open enrollment is over, your coverage is effective, it's like, okay, now how do I use my coverage? So some things that are very important to understand is what you can expect to pay out of pocket for certain things. So routine things, if you have marketplace coverage, routine things like your female wellness checkup, potentially a physical, uh, the cancer screenings, colon, mammogram, things like that will generally be covered at 100%. Deductible does not apply. There are no copays for those things. That falls into the ACA guidelines where that has to be covered under a marketplace plan at 100%. Well, you think, okay, I need labs or I'm sick or any of those things. So again, depending on your coverage, will determine how much you pay. There are some plans out there that are zero deductible, which means everything you do is a copay. Always a copay. It's good to go into your portal, which I've instructed you to set up. Go into your portal and you can look and see what your copays are. And knowing your copays is very important because unfortunately, doctor's office, surgeons, all these places do not take the time to make sure they're looking at your exact coverage. That, oh, you've got Oscar or you've got Blue Cross. Here's what you need to pay us. I had this example not too long ago. I have a family that's on Oscar, zero deductible, which means everything is copays. Family member needed surgery. Surgeon comes back and says, you owe us $1,800. And, they were trying to get it scheduled, so she called me. And I said, no, you do not owe $1,800. Showed her how to pull up the portal. Her copay, $300. She goes, so what do I do? I said, you print this page and give it to your surgeon's office. This is what you're supposed to pay, not anymore. Do not let them charge you anymore. And you just have to stand your ground. So what's another instance of when to use your insurance or to know maybe when to be a cash pay? So if you have some kind, usually MRIs are going to fall under your copay. If you have a copay, if you have a, deductible, if you have a deductible. So if your deductible is $5,000, that means your MRI is not going to get paid. It's just not, because it's all going to go to your deductible. So what else is going on? Are they trying to figure something out? Are you going to have a surgery? If they're just trying to figure out maybe what's going on, then the best idea might be to go pay cash for your MRI. There's a place in town that you can pay $500 for an MRI. Because what happens if you use your insurance in that case, they're going to bill $2,400 to your insurance. Insurance is going to say this is all applied to deductible. There might be some discount depending on where you go, but basically you're on the hook for the full amount. And if you're not going to have any other procedures and you're not worried about meeting a deductible, why would you do that? Why would you pay that much? Yes, I know you're paying for insurance, but again, the whole point is to pay the least out of pocket you can. Health insurance, you should utilize for super catastrophic stuff, not expect it to pay for all the small things unless you know you're going to hit a deductible. That might be for next year, changing your deductible lower if you're going to have high usage. So what's another instance where you can save tons of money is labs. So labs is one of those things that the labs charge exorbitant fees for tests that don't cost hardly anything. So for example, if you remember from any of my previous blogs or looked at my webpage, you know I managed medical offices for 25 years. I handled lab billing. So what does that mean? So a lot of doctors, primary care doctors, and even specialists have agreements with certain labs where the lab can bill the doctor directly for a service instead of the patient either one having to use their insurance or paying out of pocket cash for those labs. So what does that mean? So most primary care doctors do not upcharge that a whole lot. Yes, they do charge you more than what the lab is charging them, but that's because they're reading the results, those kinds of things. You're paying for their time, which is fine. I think you should pay for their time. So, example, a lipid panel, which is a test for cholesterol. If you went to any of the big labs, you would probably pay at least $85. What they would charge insurance is $85. So depending on how your deductible works, that's all going to go to your deductible. And you could be stuck with a bill if you're having a whole bunch of labs done for thousands of dollars, because that's what they charge for these tests. 85, PSA, which is a test for prostate on men, is $120 they bill. It's ridiculous. So I'll give you a little inside tip. What they bill the doctor's office for a lipid panel is $3. Yes, you heard that correct. It is $3. Yep, they're charging you $85, or they're billing the insurance $85. So the doctor gets billed $3, and you know the lab's making money. They wouldn't charge the doctor $3 if they weren't making money. And I've talked to someone who used to price labs, and they said labs don't even cost a penny. Most labs. I'm not talking specialty lab work, because that can be expensive. But just your basic, CBC, lipid panel, PSA, all those things is very inexpensive. So they bill a doctor $3, and I go to a doctor that I let the labs bill her, and she bills me. And my labs total cost me about $200. But if I allow the lab to bill it, it's $1,900. Crazy, right? So I pay the doctor $200, and that's really a good deal. If I had a large deductible, a plan with a large deductible, that's not going to be covered. So I'm really saving a ton of money by allowing the doctor to bill those labs for me, and then I'm just paying the doctor directly and not utilizing my insurance. I know this sounds crazy, but there was an instance just recently that a patient did this, that decided they wanted to use their insurance because they didn't understand their insurance. They thought, I've got insurance, I'm going to go to the lab and let them bill my insurance. Well, now they're receiving a bill for $1,900, and they're upset. Well, doctor's office would have charged them $200 to $300. They could have paid that instead of meeting a deductible or going towards their deductible, and they don't have anything else planned. They have no surgeries planned. They're pretty healthy. Why would you do that? It's because people don't understand. People don't understand it's a game. I hate to say that, but it is a game. It's kind of like buying a car. There are some places now that, price you see is what the price is. But generally, when you go to buy a car, you're negotiating. And people just don't do that with their health care because they've been trained not to. And this is how hospitals and facilities, not your primary care doctor. I don't even know that I've ever seen a primary care doctor charge exorbitant fees for their care. Specialists, yes. I've seen cardiologists do some funky things. But generally, your primary care does not do this. They charge you a reasonable fee for what they're doing. But hospitals, ERs, labs, these imaging places, it's worse than jewelry, the markup. It really is. And if you were to call some of these places and go, have no insurance, what's your cash price? You would be shocked to know what they will accept for payment. So that's one way you can really mitigate your costs, is understanding your coverage, know when to use it, understand your deductibles. You can call the insurance company if you don't. You go in your portal and you really truly don't understand. If you need labs, get the codes. If you need an MRI, get the code. They have to provide that to you, and then you can basically shop it. And why would you do that? Why would you not do that? Why would you just pay extra for something that you don't need to? No, it takes your time. Okay, it takes your time. How much is your time worth? I guess if you don't mind just dishing out a whole bunch of money, then do it. But you're paying a lot for premium. So why would you pay thousands more, which is people's complaint? I've got this insurance and I'm paying a lot of money for insurance. Why am I still paying thousands of dollars for treatment or doctor visits? Well, it's because you're deductible. If you're a healthy person, you do want a high deductible because you're not going to utilize your insurance. But then know that you should probably pay cash for certain things, because it's all going to go to deductible. Insurance isn't going to pay anyway. So I'm trying to save you money out of pocket. You know, we have to look at the premium, and then we have to look at what you're going to pay out of pocket. It really drives me crazy that people seem surprised when they get a big bill. So, all right, let's say you didn't do your homework and you didn't check to see about deductibles and all those things, and now you have a bill. I just talked to a client this morning that has a family member in the hospital. They have a plan that has a large deductible, $8,700, and it pays basically nothing until they hit that $8,700. Well, family member's been in the hospital 5 days. I said, all right, you've met your deductible. If they ask you for any money, do not pay them anything. They need to file it to insurance. And then how it should work is the insurance should come back and say, here's the deductible, this is what you should owe, this is the most that they should bill you. Okay, and of course it takes them forever to do all this, and now we're going to be 3 months later. You get a bill for $8,700. I've instructed the client to call me when they get that bill, because I'm going to review it and make sure that it's correct. If it's $8,700, it should be correct. They should owe nothing else as long as the doctors are in network. I've also instructed that said family member might need surgery. I said, just so you know, if anybody is out of network, they have to notify you 72 hours ahead, or the insurance is only going to pay them in-network fees, and you have to agree to the out-of-network fees. But if they tell you they're out of network, you ask them for a cash discount. So what we're going to do is when we get that $8,700 bill, we're going to apply for financial assistance. Yes, everyone almost qualifies for something for financial assistance, because all these hospitals, if they accept Medicare or Medicaid, they can file anything they write off to the federal government and get reimbursed a portion of that. So they're very willing to give you financial assistance. And it's not based on your assets, it's based on ability to pay. So depending what the bill is, depending on your income, they do look at all these things, and they will determine how much they give you. Okay, so we've got that hopefully knocked down to a good amount. And if it's a reasonable amount, I'll instruct the client to pay it. If it's still not a reasonable amount, we may try to negotiate further. Why would you want to do this? You're thinking, why? Well, why would you want to pay $8,700? I mean, I guess if you've got it in an account, you're happy, or slap it on a credit card where you're paying interest, go ahead and do that. I am personally not going to do that. I am not going to pay for something which I know they're overcharging me. And I guarantee you that the insurance is going to pay them way more than what their actual costs are. So why do they need an extra $8,700 from me? They don't. So this is something that I help educate my clients on, and I teach them about their insurance. I always, always, always want my clients to call me when they have something especially major going on, so I can give them counsel on how to handle this. If it's something minor and you're unsure, shoot me an email. You know, I'll tell you, yeah, that should be covered. No, it's not, or call the insurance. Fortunately, I'm only one person. So I may be on the phone with somebody else, so I can't always answer your question immediately. But if it's something planned, we can certainly help mitigate those costs. If it's an emergency, like this particular family needed to take their family member, just go, and then we'll figure it out on the back end. Usually we'll be treated and seen, and then we can negotiate that on the back end, even if we have to wait till the bill's 90 days old and in collections, which is the scary word they use, to trick you into paying these exorbitant bills. But what a lot of people don't know is they can't actually ding your credit for 180 days. So between 91 days and 179 days, you have the power to negotiate with them. Because I can tell you, every day that ticks by that they don't collect their money, the odds of them collecting the full amount go down drastically. And they're just trying to basically collect what they can. And it's interesting because if insurance is paid at all, they've probably collected their costs. So my rant is over for today. I just want to help as many people as possible. I think if everyone will stop just paying these ridiculous bills, we from the ground up can help lower our healthcare costs overall, because if healthcare costs are lower, that means people are utilizing healthcare less, premiums can go down, you know, it all kind of works together. So I always tell everyone nothing is free in the preventive scene. It's included in your premium. So if we can get our costs down and we fight against the exorbitant costs that they're sending insurance companies billing, and insurance companies are paying these ridiculous amounts and then still wanting more money from you. I really feel like if more people would do this, there would be no choice for these providers but to charge a fair fee. And all about transparency and charging a fair fee. So hop on over to my page, Shea Capital Consulting, schedule an appointment with me, and until next week, peace out.